tell me a little bit about why genetic testing is important.
It's important because it's information about who we are. It'll give us risks, hopefully interventions if we do have a mutation, something we can act on. Because a lot of times, we don't have control over that. So this is just a little bit more information. How much information do you want to know?
I think I want to understand all the risks that I have so that I can at least give that information to my kids so that they're well prepared for their future.
Because, a few years ago, we would have just jumped on doing a single site test, but the genetic community now is evolving. And what if there's another mutation in the family that we're not going to pick up when we have the technology?
And I think that's my biggest concern is if it's just focused on one area, we're only looking at one thing, we're not seeing the big picture.
I'm on the same page as you, totally. Or blood, most people prefer saliva. And is one more accurate than the other? No. The blood, they harvest the white blood cells and they get the DNA out of that. And saliva, cheek cells, and they get the DNA out of that. So cool. They put a barcode in your DNA and they put it in this huge sequencer and run all these genes with thousands of other people. That's how they've gotten the price down. You don't have to do it one by one.
Okay.
A lot of people aren't good about screenings. Who wants to do that, right? Especially mammograms and the other kind of invasive things. They're not fun. Colonoscopies, but if it's going to reduce our risk of a cancer, I think we'd be way more likely to follow through with recommendations.